Hi Matt, so to start off, could you tell us a bit about your philosophy when it comes to dentistry?
I feel really strongly about being able to equip patients with the ability to make the decisions themselves. I like to practice something called patient-centered dentistry. So I think it's our duty to say to the patients, these are what the options are, give the education for the patients, and then allow them to make their own decision of what's correct for them. You know, they are their teeth after all, so they should be the ones that making the decision. I do continue to be a dentist with function and prevention in mind. When I was a bit younger, I was able to work with the Guy's, King's, Thomas's team that were researching dental psychology. So when I feel fully equipped to help with motivation and prevention with the patients. I also think we're in a situation where, unfortunately, not many people say this, but everything that we do is going to go wrong. And actually, it's very important to have almost like something up our sleeve just in case. When this filling goes wrong, maybe we've got a slightly bigger filling we can do. Unfortunately, there are too many people that look at the mouth as a snapshot and maybe put a crown there where they could think about something simpler. All of the metrics show that oral diseases are on the rise. Gum disease, tooth surface loss, and most worryingly, oral cancer on the rise. I feel it's our duty as clinicians to really prevent and push people forward and get that knowledge base out there.
So Matt, could you share a bit about your background and your experience in the field of dentistry?
Been a dentist for just over 25 years, 24 and a half of those as a Denplan member dentist. And I've been very lucky to settle in a really nice practice in Greenwich in South East London. So I started off as an associate dentist there. Went through to purchasing the practice, which was in the basement of a Victorian house, so very much how practices used to be in the past. I identified very quickly that that's not how we wanted it to be, and we were able to find a better venue, have a purpose-built practice, and our team kept growing and growing and growing. Since we moved practice, we doubled the practice size, and I think the staff have probably quadrupled. We've got a fantastic team of nurses, hygienists, associate dentists as well. And on top of that, I was able to do some research with Guy's, King's and Thomas's. So we looked at a lot of psychology relating to dentistry, how we can prevent more effectively. And I was really keen to improve my clinical skills. So I've done a couple of years worth of implant courses and a master's degree on top. And for about the last 5 years or so, I've been working as a Denplan practice advisor. So as a practice advisor, I think there are 18 in the country at the moment. We get together every 18 months or so, and we're the people that go out and assess for the Denplan Excel accreditation.
What's actually attracted you to Denplan and to take on the role of head dental officer?
As you know, Denplan is almost 40 years old, and Denplan was set up in a way to try and stop the patients coming in, having a load of work done, and disappearing. And actually it's about trying to get patients into the practice on a very regular basis, which is exactly what we like. And I've been a member of Denplan for 25 years. They've been extremely helpful to me during my career. I've also been really keen to make a positive difference in the world of dentistry. And when I first saw the job description come out, I just thought, is this something I could do? And then I put my phone down on the side and picked it up again and read through the job description again and put it down. I just thought, I didn't want to be sitting in the armchair in 10 years' time thinking, what if I'd only, So I knew some of the team that here at Denplan already. So I picked up the phone, gave them a call, talked it through, and they were really, really excited that I was even considering the role. I want to do good. We all hopefully want to do good. And I just couldn't say no.
So you've been with us for a few months now. How has your experience been with us so far?
Oh, it's just been amazing. I mean, I really love learning, and I've had to learn a heck of a lot. The breadth of knowledge that you have to have for this position is just phenomenal. Meeting a whole host of really interesting, excited people who are just desperate for Denplan to do well, and people like John, head of product, and Elliot, head of sales, they're really, really keen on pushing Denplan forward in this modern world of dentistry. The only difficulty I have really is turning my brain off at night time. There's so much going on all the time. New, interesting, exciting ideas are jumping through my head, and it's such a great time to be innovative.
Could you tell us a little bit more about the Excel programme and how it fits into your role?
The Excel programme, for those that don't know, is an independent mark of quality for dental practices and also clinicians as well. Nationwide, we have a team of 18 practice advisors that will go around to a practice that wants to put their hand up and thinks that they're good enough to receive the accreditation. At those accreditation visits, the assessor will go around, check policies and protocols, but also, most importantly, we'll actually go through the note-making the clinician's making, and in a very, very friendly way, we'll give feedback. And, we all want to be doing the very best that we can for our patients, so it's such a good, easy way to elevate where we are. Those visits happen every 2 years or so. And then in between, you can have a voluntary, what's called a compliance health check, which just is a very straightforward tick box exercise. It's not just trying to be the best, but it's actually showing people that you're the best.
And Matt, how do you feel like your role can support the Denplan team?
I think the biggest thing that I bring is that I've gone through most of the stages of dentistry. So I started off as an associate dentist in an independent practice, all the way through business ownership to selling the practice, and then working for a corporate as an associate as well. And not many people have been through that journey. The team are able to draw on those experiences that I've had and use them for strategy, use them in the product area, and really try and push the boundaries of what we can give at Denplan. I'm really keen that the teams that I work with are super ambitious, and really what we should be doing is smashing through where we are and really pushing beyond what members expect of us.
With your experience being a Denplan dentist, how do you feel like Denplan has supported you in your practice?
Going to university kind of sets you on the path to being a good dentist. Unfortunately, being a good dentist has little to do with running a successful business. So I was very, very lucky that when I went through my time of transitioning from an associate dentist to a practice owner, I had a really good business development manager that I really bonded with. And he was able to help me set the Denplan fees, work out the KPIs that I should be looking for, explain all the business terms that I had no clue about. And that was a massive benefit from the running a practice and being confident that we could be super successful in that. It also became a strategy for me as a practice owner and a businessman that I thought that Denplan could cover the kind of outgoings of the practice. So I'd have lots of confidence knowing that we were in a situation where all the bills were paid every month. So we didn't have to worry about the nurses and the hygienists being paid. And the other flip side to things is that the patient actually benefits as well. So they don't have those big peaks and troughs. There is just a gentle trickle all the way forward. Denplan have made a massive difference to me, both personally and professionally, with all the networking that I've been able to do with the Dine with Denplan, the ski conferences and the hiking conferences that we've been on. It's a great way of getting out and meeting like-minded individuals. In the future, I'd really like to support my colleagues, in the same way that I've been supported in the past. Dentistry is a very, very different world now than it was 20 years ago when I first started. And, Denplan recognise this, and what they're doing is they're really investing heavily in this so that we know that we can be confident going forward.